What inspires change? What motivates us? It's what's inside that moves us. What moves you? Get the Scion story at Scion.com.
Governor Eddie Calvo announced that he has looked at the options presented to him by the GovGuam Health Insurance negotiating team and has selected the non-exclusive option. This will allow GovGuam employees to pick from 3 health insurance providers.
He had 2 choices. He could have either given the GovGuam employees no choice, which would be just one insurance company to get the contract, or he could give them multiple choices of multiple insurance companies who qualified to provide health insurance to GovGuam employees. And you know, over the past couple of years, this has been a hot issue, especially a controversial one, especially for the Calvo Tenorio administration. And the governor just wants to let people know that he's listening and he understands where the criticisms have come from, and he's chosen the non-exclusive. He's chosen to allow for multiple carriers.
The governor's director of communications, Troy Torres, says that the governor would have likely chosen the same thing last year, but the health insurance contract was mired in protest. Senator Ben Pangilinan has attempted to pass Bill 81 that would have also allowed GovGuam employees to pick their health insurance provider, but this bill was vetoed by the governor. So why not just sign Senator Pangilinan's bill into law?
If we had gone with Bill 81 and what Bill 81 would have done, it would have changed the entire process to an IFB, meaning there would be no negotiating of rates. There would only be a cap, and everybody who fits into the cap and qualifies would be able to provide insurance coverage.
Senator Pangilinan agrees that his bill is different from this scenario, but for different reasons.
If you look at that, it would be multiple options that would be the most beneficial and economical plan to the government of Guam, the employees, and their families. So it still had that. You have to consider what would be the most economical and beneficial plan if you were going to go that way.
Senator Pangilinan says that in this particular case, the exclusive scenario, which means GovGuam would pick one specific health insurance company, would actually save GovGuam more money than the non-exclusive scenario. In fact, he pointed us to a memo sent from the GovGuam Health Insurance negotiating team to the legislature. The memo states that the non-exclusive option would reduce the cost for GovGuam by $1 million, assuming that each vendor successfully enrolls 1/3 of the population. But it also states that the exclusive option would save GovGuam $18.7 million.
It just leaves us puzzled why we wouldn't take that option and take those savings and put them into the departments, the agencies, the employees, the community, and the needs of the people of Guam.